Welcome back to River City Live. We are kicking off our Mental Wellness Wednesday with Dr. Christine Cauffield of LSF. Thank you so much for joining us. We've got a little bit of a heavy topic today.
We do.
But it is one that we need to address because we are going to give you effective tools on how to address and combat the addiction and disease that we all know as drug abuse, drug overdose. And like you mentioned before we were talking in the commercial break, it is a disease.
Absolutely.
And a lot of times we don't address it as that. It's thrown around very casually as someone's a druggie or they drink too much. It's very flippant, but it's something that is a health disorder.
Most definitely. It's a brain disease, and you know, you just can't pull yourself up by the bootstraps. It's like any other disease. It requires treatment, and the good news is recovery is possible. It's also a family disease. If you are living with someone that's addicted to, for example, opioids or alcohol, it's going to affect the family. And so it's very important for everybody to get into recovery in that situation.
And that's so important. It was funny when I was bringing us in, I just had this flash of a lot of people I know that have battled these challenges. And it makes you a little bit emotional because I think we all know somebody who has had to either deal with this with a loved one or deal with it themselves personally.
Most definitely. And a lot of people don't realize this, but it's a genetic disease. It's inherited. And if you inherit that gene for addiction, then you really have to take steps to ensure that it does not move into a serious situation.
Right. How can we detect signs like that, whether it's in ourselves or maybe a loved one that we have or a friend in our circle?
Well, if you, for example, are drinking alcohol and you find that you need more and more of alcohol or any drug you might be utilizing, your tolerance is increasing. That's one sign. Another sign is if you are living with someone who suddenly is running out of money, wanting to borrow money, that's a sign that there might be something serious going on. Additionally, if you're noticing behavior changes, increased agitation, increased anger outburst, a change in friends if you have teenagers, those kinds of things should be red flags to let you know that something's going on here.
Right. And do you see a connection between substance abuse and other mental health disorders? Do these ever go hand in hand or even amplify each other?
Absolutely. What we're finding in the research supports is that about 80% of individuals that live with an addiction also have a co-occurring mental health challenge. Depression, anxiety, post-traumatic stress disorder, those are very common and concomitant with that addiction. A lot of people self-medicate because they're in pain with their mental health issue, and so they pick up to dull the pain.
Sure. I mean, none of us want to lean into that. It's a difficult thing to do, and it's very easy to step away and maybe step towards something that we can self-medicate with. Something you and I talked about last week was how to be an effective communicator when it comes to helping someone address this without being defensive. So what are some of the tools that you all use at LSF to help people address this for a loved one, or like we said, a friend in your circle, or even if somebody maybe is listening to this and says, maybe I do need help and maybe I deserve help, because they do?
Absolutely. For sure, there's help out there. It's very important to share that you're concerned about the individual, that if it's a family member, you love them, you're recognizing that additional support is needed for the entire family, and that you're there for them. You'll help them in any way possible. And the good news is there are resources in the community, no matter what your economic status is, to be able to get the help that you need to fight that addiction and to enjoy recovery.
Yes, and battle it together as a community, because that's the reality, is we're all here for each other. And just remember that something like this doesn't look at your family history. It doesn't look at what you do for a living. It could be a very successful person. It could be somebody you think has it all together. Those people can also have challenges. So just be aware of your friends, check on your friends and family, be aware of those around you at work. And if somebody needs help, please reach out to LSF. They have resources. They have wonderful people like Dr. Cauffield that are there to help you and talk you through it. Thank you so much for another great Mental Wellness Wednesday.
Pleasure.
Stick around for more River City Live right after